Hello, friends. Total knee replacement is one of the most successful surgeries of the last 3 decades. However, its success has also attracted some misuse. Arthritis is not a disease, it is age related degeneration. And like graying of hair, it can happen even in our early 40s. While most of us have realized that weight control, knee exercises, alteration in lifestyle, and with some painkillers off and on, we are able to manage our lifestyles. However, there are 4 crore Indians who are seeking surgical options. With more and more surgeons getting familiar with total knee replacement surgery, they are offering it to one and all arthritic knees, which may be an overkill. Today is the day and age of precision medicine. We need to evaluate our patients carefully. We have to look at their age, their bony alignment, their cartilage lesion, their activity level, their recreational options, and their socioeconomic status to decide the surgery for them. Not doing so is hampering care. Offering everybody total knee replacement may not be right. We use an a la carte approach while we manage the arthritic knees. In patients who are in their late 40s and early 50s, essentially high activity people who have degeneration of their medial compartment with a cartilage lesion, maybe a meniscal tear, and an alignment loss, we realign their knees using high tibial osteotomies. We reconstruct the ligaments, we repair the cartilage, and even suture up the meniscus. These are called knee preservation surgeries. Many patients have damage to only one compartment of their knee. It could be the medial compartment or the lateral compartment. And these are the patients who deserve to undergo a partial knee replacement and not a total knee replacement. We have been doing these surgeries for last 2 decades with excellent results. Here, we just resurface the compartment, do not touch the intact ligaments, and patients are able to get back to their pre-injury level of activity faster. As compared to total knee replacement, they have less complications, less pain, and early recovery. So, in all, we have 3 options today for every patient. Either a knee preservation surgery in which we repair the ligaments and cartilage and realign the knee, a partial knee replacement, or a total knee replacement. Knowing all these 3 procedures is extremely important for a surgeon to offer the right care to its patient. Today, unfortunately, the lack of awareness on part of the patient and limited expertise on part of the surgeon is hampering care. We need to understand that all these 3 options can be utilized for every arthritic knee to provide proper care. Our work on partial knee replacement has been used by the NHS in their NICE guidelines, which mandates that every patient who comes for a total knee replacement to a surgeon has to be evaluated for the possibility of partial knee replacement. And if the patient is not being offered partial knee at that center, he should be referred to an appropriate center who can offer the partial knee surgery. In our military practice, for more than 2 decades, we have been performing knee preservation surgeries in which we have been realigning the knees, we have been repairing the cartilages, suturing up the meniscus, and healing the cartilage to allow restoration of full activity in our soldiers. In today's day and age, not knowing the right surgery for you is hampering care. What you need to do is to know your surgeon, know your options, and to visit a center who can offer all 3 kinds of surgery: knee preservation, a partial knee replacement, or a total knee replacement. All the best.